Meet Dorothy. Dorothy is a 75-year-old lady with type 1 diabetes. She is being treated for a urinary tract infection. She is getting better. Dorothy took her usual Humulin M3 insulin at 8 o'clock in the morning. Dorothy's appetite is reduced and she refused most of her breakfast. At 11 o'clock in the morning, Dorothy's blood glucose was 3.8. This was reviewed by Dr. Cooper, who advised for Dorothy to wait until lunch. At 12 noon, Dorothy was restless, sweaty and confused. She got out of her bed and collapsed. After initial management, blood glucose level was noted to be 2. Meet Dr. Cooper, the medical FY2 who reviewed Dorothy when her blood glucose level was 3.8. What would you do differently, Dr. Cooper? Yes. 4 is the floor. Recognize hypoglycemia when blood glucose level is below 4. That's right. You would give quick-acting carbohydrates in accordance with hospital guidelines. Yes. Check blood glucose every 15 minutes until blood glucose level is above 4. Good. You would review Dorothy's insulin dose. Remember, 4 is the floor. Recognize hypoglycemia when blood glucose level is less than 4. To prepare the equipments needed to treat hypoglycemia, find your nearest hypo box. Always review the dose of insulin in hypoglycemic patient. Check the hospital algorithm for the treatment of hypoglycemia. If your patient is conscious and able to eat, give 5 to 7 glucose tablets. Alternatively, you can give 120 ml of Lucozade. If your patient is conscious but unable to self-help, give 1 to 2 dextrogel tubes. If your patient is unconscious with available IV access, prescribe and give 20% glucose infusion. If your patient is unconscious without IV access, prescribe and give 1 mg of intramuscular glucagon injection. In the meantime, try to secure an IV access. Remember to recheck blood glucose levels every 15 minutes and repeat treatment as per guidelines until the blood glucose level is above 4. Once blood glucose level is above 4, give long-acting carbohydrates such as biscuits, a sandwich or next available meal. Check blood glucose every 30 to 60 minutes until stable.